Johns Hopkins Medicine.
Known for groundbreaking research, teaching, and medical care.
Hello, and welcome to Johns Hopkins Medicine Facebook Live. I'm Dr. Allison Agwu, and I'm an adult and pediatric infectious disease specialist with the Johns Hopkins Hospital and Johns Hopkins Children's Center here in Baltimore, Maryland. So flu season is here upon us, and today we're going to talk about how you can prevent flu infection as well as COVID-19 infection. I am pleased to be joined by two of my colleagues, Dr. Lisa Maragakis, Senior Director of Infection Prevention for the Johns Hopkins Health System, and Dr. Aaron Milstone, Pediatric Infectious Disease Specialist with Johns Hopkins Children's Center. Thank you both for being here with me today.
Thanks for having us.
Thanks so much for having us.
Absolutely. So first, let's jump in. What are the potential symptoms of the flu and of COVID-19? And importantly, which symptoms are exclusive to COVID-19?
I'll jump on that one.
Awesome.
Thanks, Dr. Agwu, and thanks, people, for tuning in. As you know, there's a lot of overlap in the symptoms that we see with both influenza and COVID. One that's notable for COVID is loss of taste and smell. So if people find that they've lost their taste or lost their smell, that is highly suspicious of COVID-19 infection. But other than that, most of the common symptoms like fever, cough, sore throat, aches, chills, those can happen with both infections. So if you develop those symptoms, especially at a time when we're seeing both of these viruses in the community, it's really important to talk to your physician about whether or not you should get tested for one or both.
Anything to add, Dr. Maragakis?
Well, I think it is very important this season more than ever that you do reach out to medical professionals to help sort through your symptoms and to get access to testing. And we know that in the past we've been able to make some assumptions about what those symptoms mean and even use empiric therapies for flu, for instance. But this year with COVID-19 versus flu, we really will need those test results.
Yeah, really important points, both of you, especially the things that may distinguish them, but really the fact that they really do overlap and not making assumptions and when needed, really get tested. I want to remind the audience that we are live, and if you do have questions or comments, please go ahead and put them in and we'll try to get to them as well. The goal is to have a dialogue. So maybe we'll go with you next, Dr. Maragakis. How do the flu and COVID-19 each spread? What are the uniqueness to both?
Well, you know, these are both respiratory viruses. So the main thing that we need to think about is how respiratory viruses spread from person to person. And the main way that happens is through respiratory droplets, so coughs, sneezes. But one thing that has really been made clear during the pandemic is that non-cough and sneeze activity can also produce respiratory droplets. And so that's talking, singing, or even just being in close proximity to someone. And we find that a lot of the risk is during unmasked activities indoors, eating together, for example, in an indoor setting with masks removed. So those respiratory droplets contain viral particles and can transmit both influenza and the SARS-CoV-2 virus that causes COVID-19 from person to person. It's one of the reasons we need all of those layers of infection prevention precautions to interrupt transmission and to continue to be cautious about the settings in which we're getting together, particularly in the colder winter months as they arrive.
Yeah. I think so important as we now go inside with the cold weather coming, with Thanksgiving and the holidays coming, and really thinking about what we're doing and what settings we're in. So important. So, I mean, just to step beyond that, so what are the best methods then to prevent the flu and SARS-CoV-2 or COVID-19? Maybe Milstone will do a little bit of the tag team. Go ahead, Dr. Milstone.
Yeah, so that was a great explanation, Dr. Maragakis, and it really does lead into these prevention strategies. And the one that we're seeing is especially important is vaccination. We know that vaccination is really both for influenza and for COVID. It doesn't always 100% prevent people from getting sick, but it keeps you safe. So it keeps you out of the hospital, it prevents death. And that's why the goal of vaccines is to reduce mortality, death, and severe disease that leads people to have complications that put them in the hospital. So the first thing I would encourage everyone is to go out, and if you haven't gotten the COVID vaccine, get the COVID vaccine. If you haven't gotten your flu shot yet, go and get your flu shot, the vaccine for flu. That's a great strategy for preventing flu. And then again, adding to what Dr. Maragakis said, we know that wearing a mask is really beneficial for both of these, to prevent both of these viruses. Hand washing, if you're sick, stay home. Being in an area that's well ventilated, that'll help diffuse those respiratory particles as they go into the air. That's very helpful. So it's really a combination of strategies that is the most important to prevent disease. It's not just one, it's a combination. But we really want to emphasize the vaccine is a fundamental pillar in that prevention approach.
So it's so important, I think, with the masking and everything, but also this whole concept of presenteeism and going and giving your kids some Tylenol and sending them to school with a snotty nose and saying it's probably better to keep people at home and to avoid spreading. It's a really important concept. So I heard you mention the COVID vaccine and the flu vaccine, and one of the questions we often get is, well, do I have to get this flu vaccine every year? And what do you say to that? And if yes or no, and if so, why?
We say it's important every year to get your flu vaccine, but now more than ever because of the reasons we've talked about, the fact that we are likely to see multiple respiratory viruses circulating this year, and the vaccines, as Dr. Milstone just outlined, are our very best first-line defense against severe disease and death that happens every year from influenza, and now for the last couple of years from SARS-CoV-2 or COVID-19 as well. So absolutely would recommend everyone to get their flu vaccine. And now is the time, if you haven't done it already. The Centers for Disease Control and Prevention recommends that you get it by the end of October. Obviously, we're into November already, but it's not too late. And we're just starting to see influenza cases, and so you still have time. But just remember that it does take a couple of weeks after vaccination before your immune system can fully respond to that vaccine and give you the protection. So ideally, go do it now before holiday activities start coming, for instance.
And is it safe to get both?
Can I add one thing to that? Especially this year, as a parent and a pediatrician, I think we all appreciate the disruption that's being caused by COVID to our everyday lives. And one of the special benefits to the flu vaccine this year is if it keeps you from getting another respiratory illness, it'll prevent you from having to go and get COVID tested, from having to miss work, from your kids having to miss school. So if we think of the disruption that's been caused by the pandemic, keeping people healthy with any prevention measure, the vaccine especially, will hopefully reduce some of that disruption in our day-to-day lives.
Definitely. So just to remind the audience, please, we want to get your questions. Please take the advantage of having us here. Speaking about vaccines, can you get both the flu vaccine and the COVID vaccine at the same time? That's a question that commonly comes up.
That's a great question, and I'm really happy to say that the answer is yes. You can get both vaccines at the same time or very close to each other. And that is true whether you're getting the first part of the series, the COVID-19 vaccine, or whether you're thinking about going and getting a booster. But they can be administered together, the flu vaccine and the COVID-19 vaccine.
And it's not just the flu and the COVID, it's also a great time for either kids or adults to get caught up on other vaccines. I have friends who've gotten their shingles vaccine or their pneumococcal vaccine, these other really important vaccines. You can get those at the same time. So if you're going in to get either your flu vaccine or your COVID vaccine, it's a great time to ask your provider if there's another vaccine that you can get at the same time that will also prevent you from another disease.
Very good point. Dr. Milstone, we've gotten lots of questions about this, the recent approval of the vaccines for the 5 to 11-year-olds. What can you tell the audience about this recent approval and any recommendations, thoughts, or just about the vaccine that's been recently approved for that population?
Well, I'm really happy for the parents of people who have 5 to 11-year-olds. I know how happy my wife and I were when our kids who were a little older, became eligible for the vaccine, and they were able to line up and be some of the first to get those vaccines. So I'm really happy for those families, especially with the holidays coming. So it's a good time to take your kids to get vaccinated as soon as possible. We definitely know that these vaccines in that age group are safe. The dose being given to kids 5 to 11 is lower than the dose being given to kids who are in that 12 to 15 group. we get lots of questions about what that means. Why is the dose lower? You know, when we're coming up with vaccines, or when the manufacturers are identifying the right vaccine, it's trying to find a sweet spot. It is, how do we give enough so that our immune system wakens up and is ready to fight the infection when we get exposed to the virus? But at the same time, we don't want to give too much that we have unnecessary reactions where people get more fever or more soreness or more fatigue. So it's trying to find that right balance of a good immune response and not many reactions. And that's why the doses are different across different age groups. And we see this in other vaccines, like the chickenpox vaccine given to kids and the same virus, the shingles vaccine given to adults. They're different doses because that's what's appropriate for those populations. So we know it's safe. It's now been given to over 1 million kids between the age of 5 and 11. It's working well, and we would really encourage parents to get their kids vaccinated.
Such good points. I mean, I have an 11-year-old, and he has an older sister, and he was so upset that he couldn't get vaccinated. And so as a parent, I've been so excited. Of course, I couldn't get him a spot. Finally, got him a spot to get vaccinated. And those are the kinds of questions that many of his kids, his friends' parents are asking. So thank you for clarifying that. Dr. Maragakis, what can you tell us about the recent approval of the COVID-19 booster shots for certain groups?
Well, this is more great news that we have wide availability of the COVID-19 vaccine for all of the eligible groups in this country. We're very fortunate to have that and need to remember that, because it's not the case in all countries of the world, and lots of efforts are underway to work on that piece. But here, we have now authorization for boosters, as you say, and there are a variety of different groups that are eligible to get the booster. And it depends on which vaccine that you got originally. So anyone over the age of 18 who had the J&J COVID-19 vaccine is eligible to get a booster, and I would certainly encourage everyone to take advantage of that opportunity. If you got one of the mRNA vaccines, the Moderna or Pfizer, and you are immunosuppressed, then it is really advisable. And by immunosuppressed, I mean you have one of the conditions that leads to moderate or severe suppression of your immune system. And sometimes in that case, you may not have had a full reaction, immune response to the first 2 doses of vaccine. And so in that case, you're eligible to get a 3rd dose. It's kind of like a booster, but it's really another opportunity for vaccination to really take hold in people who have suppressed immune systems. And then there are another eligibility, wide eligibility for those who are over the age of 65 and got the mRNA vaccine series. Those who are over 18 and have underlying health conditions that place them at higher risk for severe disease from COVID-19, and actually a very large group of people who have occupational exposure risk. Because of the nature of their job, they're at higher risk of coming into contact with the virus, and they are also eligible for boosters. So they're widely available, and I would definitely encourage you to look into your eligibility and seek out a booster, especially if it's been more than 6 months since you had that first series.
Yeah. No, great information. So thank you for the live questions that are coming in, and please continue to bring those in. We have several live questions. I'll start with one. This one I'll throw to you first, Dr. Maragakis. Any special recommendations for transplant recipients who have not developed antibody responses after 3 COVID vaccine doses? What are your recommendations there?
Well, what we do know is that 3rd dose, as I said, offers the opportunity for another chance for your immune system to respond to vaccination. If you have, in fact, a suppressed immune system and you have gotten all 3 doses and have not seen a response, I would encourage you to work with your physician just to make sure, first of all, not all antibody tests are created equal. So you need to work with your medical provider to make sure that you're understanding if truly you don't have any antibodies that are detectable. Some of them measure neutralizing antibodies. Others look at different types of antibodies. So that's one thing. There are other parts of the immune system that are also available to fight infections. So the lack of antibodies on a given test doesn't mean that you're completely unprotected. And then finally, I would work with your medical provider to see, once you've looked at the immune response and the kind of the totality of the available tests to understand if you are or are not protected, looking at the mix and match strategy for booster shots. So which types of vaccine did you get? And it might be worth considering getting a different brand at that point if you truly don't seem to have responded to the one that you got.
Such a good response, Dr. Maragakis. And I think reminding people that vaccine is part of an additional strategy. So not forgetting the mask,
That's right.
those people who are in your household who can be vaccinated, making sure they're vaccinated, and being very careful. So great question, great response, and great question. Go ahead, Dr. Milstone.
No, I was gonna follow up exactly what you said, is that to encourage the people around them to get vaccinated and use those other strategies for prevention. So.
Another question, why do some people have such an intense reaction to COVID and others have none? And I would say COVID or the vaccine. I'm curious, either of you respond to that one.
I would say this is not different than what we see with other infections, whether it's the influenza virus or other bacterial infections. I'm sure anyone can think back in their life where they were in a household setting with someone where one person got more sick and someone else had very mild disease. We're still learning a lot about why people have different responses to infections, different severity of illness. There may be genetic components to that. There may be the amount of the virus that you're exposed to. Someone might be exposed to a small amount. Other people might be exposed to a larger amount of the virus. So there are multiple components that can play into that, but we definitely see differences in presentation.
So then we always hear about all the different variants, Delta, et cetera, right, depending on the day. And this question is from a viewer. Which new variant are you most concerned about, and what is the timing of the next peak? What's coming? Maybe Dr. Maragakis take that one.
Sure. Well, ongoing surveillance is being conducted looking for variants, of course, which is the first step, so that we're aware of what is out there and how the virus may be changing over time. What we have seen from those data is that the Delta variant continues to be the predominant variant that is here in the United States anyway. And that really started in late August, early September, and continues to be the case. We are, however, as this question suggests, looking worldwide at other variants. There are the Mu and Lambda variants that are being watched very closely. And then, of course, the Delta Plus is another one that is very similar to the Delta, but has been seen in Europe. So we'll keep an eye on all of these. Excuse me, we'll keep an eye on all of these. But right now, Delta is the primary one.
I think such a relevant question, particularly as the travel rules have started to change and relax again, right? And so I think surveillance is going to be key. But great answer to the question. Another question from a viewer, and again, please keep them coming in. I love this. If you may have had a reaction to the vaccine, should you get the booster? What are your thoughts?
So,
maybe both of you.
I think it depends on what the reaction was. We know it's common for people to have a sore arm, chills. When I say common, in the range of 10% of people maybe may have a fever after the second dose of the vaccine. A higher percentage may have a sore arm. Some people get fatigue and chills. It depends on what kind of reaction you're talking about. Those are reactions that we expect and anticipate and are normal. It's part of your body's immune response to that infection. So we think that's okay and shouldn't be a reason why you wouldn't get a vaccine. One thing we have shown is that if you had those reactions, or if you didn't have those reactions, if you had no reaction to your vaccine, it doesn't mean that your body didn't respond. We showed that in a whole group of people who had no response to that vaccine, no pain, no fever, they still had a good response to the vaccine. So just because you didn't get a reaction doesn't mean you didn't respond to the vaccine. But I think if you had an atypical, like an allergic type reaction to the vaccine, that would be a good time to talk to your provider about the safety of getting an additional dose.
Definitely.
I would just add,
Yes.
you want to report any of those severe reactions as well.
Great point.
Definitely. One of the other questions that comes up often is we are always trying to figure out who's at more risk for COVID, but maybe you can talk about who's at risk for having severe flu and COVID, just to give people a sense of what they need to be worried about.
Yeah, there's some common risk factors for severe respiratory disease, including age, both the very young and the very old, for flu in particular, and excuse me, older age groups for COVID-19. We know that children have been less susceptible, and we're really grateful for that fact. Although with the Delta variant, we've certainly seen an increase in pediatric cases. And then underlying medical conditions are certainly a risk factor for more severe disease. So adding a respiratory viral infection on top of an underlying medical illness can also certainly lead to more severe consequences, and particularly if there's any degree of immunosuppression due to that medical condition.
And I think another big one right now is unvaccinated. So people who are unvaccinated are surely at higher risk of having severe disease than people who are vaccinated.
I think so important to mention. Well, time flies. Thank you so much, Dr. Maragakis and Dr. Milstone, for talking today. It is always great to talk with you, and I'm glad we can get this time to share a little bit about this important topic. And thank all of you for all your questions and for watching. We hope you enjoyed it, and we do encourage you to follow Johns Hopkins Medicine here on Facebook and all our other social media platforms. And to learn more about COVID-19, please visit us at hopkinsmedicine.org/coronavirus. Thanks again. Stay safe, stay healthy, and stay happy. Have a good one.